Did you know that vitamin B12 levels and sunlight are related? Could our modern industrialized society be causing our B12 deficiencies? Well, stay tuned for this episode because I will be discussing everything you need to know about vitamin B12, including things you may not have ever heard before. Make sure you watch right until the end of this video when I'll be sharing my Dr. Janine self-healing meditation for vitamin B12 absorption and 9 tips for how to increase vitamin B12 in your body. Things that you can start doing today. If you have questions and comments, I'd love to hear from you. Please leave them below. I'm Dr. Janine Bowring, best-selling author and naturopathic doctor, and I'm excited to be talking about this, talking about B12 because so many people have misconceptions about vitamin therapy, supplementation, and B12 is a big one, especially amongst vegetarians and vegans that are notorious for being very low in vitamin B12. So we're going to talk all about that today. So what is vitamin B12? And here are some of the things that you need to know about vitamin B12. Well, it's actually called cobalamin because it is bound to cobalt, cobalt being a mineral. And there's different types of B12. So there's methylcobalamin, there's adenosylcobalamin, and there's cyanocobalamin, which is my least favorite, and we'll get to that in just a second. But you can imagine why I don't like cyanocobalamin. That's just a hint for you if you've not heard of this before. But the thing about B12 is that our body does not produce it. It's something that is produced actually from microorganisms. And when herbivore animals will consume the B12 that is existing in these bacteria on different herbs and plants, this is how they get it into their system, and then it recycles in their livers. And this is why some of the best sources for actually ingesting B12 is from animal sources and from the organ meats. So this is, that's why one of the reasons why vegetarians struggle in this department. But it really is a vitamin that has, and the only vitamin that contains cobalt, cobalt being that trace element, and it needs strong stomach acid in order to be absorbed properly. And why is that? Well, the cobalt is actually bound to proteins, and if we don't, and we're lacking in that stomach acid, we won't be able to separate out that cobalt, and that's why so many people have a deficiency in vitamin B12 because their stomach acid and their digestive tracts are compromised. Now, cyanocobalamin. This is, again, one of the things that I learned when I was back at the naturopathic college, and that was a long time ago, probably almost, I can't even do the math, over 25 years ago. And this is something that, when I learned about this, that cyanocobalamin is, yes, cyanide plus cobalamin. And it's a very inexpensive way to ingest the cobalamin as B12, and that's what most of the industry is making in terms of B12 supplements. But this is a problem, and I think, if you think about it, maybe you don't have to think too far to know that, ingesting cyanide maybe is not in your best interest for your overall health. The problem with ingesting the cyanocobalamin in your B12 supplements is that it goes through 4 stages of breakdown in your body, and each time it's giving off little bits of cyanide into your body, and we know that cyanide is toxic. So again, I really want people to, pay attention when you're supplementing with, it could be a B complex, it could be your B12, it could be your multivitamin. You really have to check your labels and look for that cyanocobalamin, and then you make the best decision for yourself in terms of if that's something you're going to continue to take, if that's what you're finding. But also, there's different types. There's also methylcobalamin, and methylcobalamin is actually given for cyanide poisoning because we know that the cobalt will bind that cyanide. So for people that have unfortunately been poisoned with cyanide, this is one of the things in emergency medicine that can be given in an IV to chelate out that cyanide. Now, when we talk about adenosylcobalamin, this is the type that I like in terms of supplementation, which we'll get to, make sure you're staying tuned right to the end of this video because I'm going to talk about the best ways and how to maximize your B12 absorption. But it's the adenosylcobalamin that goes right into the mitochondria, and the mitochondria are energy-producing cells of the body. This is where we get our vital energy, and this is why B12 is one of those important B vitamins to help with stress, but also to help with giving us energy throughout the day. day. Now, some people will lack something called intrinsic factor in the stomach, and this is called pernicious anemia if it's an autoimmune disorder, which we can see here in this picture. And if you don't have that intrinsic factor in the stomach, what happens is that you're not able to absorb your B12 into your bloodstream. And this is why, for people who have this condition, this is a problem, especially if you're taking the cyanocobalamin or the dietary B12 or even the methylcobalamin. There's an issue with absorption if you have the pernicious anemia. Now, that's why I love the adenosylcobalamin, because it bypasses the stomach acid issue. It also bypasses the fact that you need to break it down, and it goes right into the mitochondria. So that's, why when I take a B12 supplement myself, I take the adenosylcobalamin. But if you're wondering about those things, check the links below. We're going to share some links to the best, supplements, the ones that I take personally, in terms of being able to make sure and ensure that I'm absorbing my B12. Now, here's something that you probably haven't heard about vitamin B12, and that's the fact that it is a photoreceptor. So yes, we need the sunlight, and you've heard me talk a lot about the sunlight and the importance especially of getting that early morning sun, but our sunlight and water also help with our B12 levels and help our mitochondria. And this is where, when we talk about the environment in which we live, and a lot of that blue light that we get from our devices is the worst thing, especially at nighttime or close to bedtime. It messes up our circadian rhythms and our melatonin levels, but also the non-native EMF. So all of those cell phone signals and the 5G, this also is potentially messing up our B12 levels. So no wonder we're tired. No wonder people will start to develop psychiatric disorders because of all of this non-native EMF and the blue light in our toxic environments. It's, partially linked to B12, and that's why it's important. And we're looking at finding solutions about, improving our health and our status, that we're doing it in a natural way, but also taking care of our environment. So how do you know that you have a B12 deficiency? Well, in our blood work, so if you go to your doctor likely will do your blood work, and sometimes it's one of those tests that you need to ask for. So not every doctor will check your B12 status, but you want to know where your level is at. And in blood tests here in Canada, the normal range that is indicated on blood work, and I checked mine recently, and it said between 138 and 652. Those are the numbers, the parameters of picomoles per liter. This is supposed to be a good level. Well, did you know that in some countries, if you have anything less than 500 as your level of your B12, that supplementation and aggressive supplementation would be indicated. So Japan and some European countries, anything less than 500 is a problem. And here we would be deemed okay if we're at 140. That's a far number off of 500. So again, food for thought. And this is something that in one of my eldest son's friends had a low B12, and I said, okay, what's your number? And he was at about 350 or so, and I said, and he still, had some of the symptoms which we're getting to of B12 deficiency, not having a lot of energy and some of the other symptoms which I'll discuss in just a moment. But, and he was at 300, so the doctor thought, okay, your B12 is fine, you don't need to supplement. I thought, no, that is nowhere near fine. And a lot of practitioners, want you up in the 800s, 900s to have your B12 level at that level. So again, the numbers aren't always going to give you the best information. You have to go by how you're feeling, and of course getting the right information yourself to help yourself. And for some people that are extremely low, they have the option, and the doctor will often recommend a B12 injection. And the problem with this is that most times it is the cyanocobalamin. So again, if you are having B12 shots, you have to ask your doctor to find the alternative to the cyanocobalamin, or find a really good supplement that's super well absorbed, like the adenosylcobalamin. So how do you know that you have this B12 deficiency? Well, there's different stages. So in stage 1 of a B12 deficiency, this would be that decrease in your blood levels. So again, when your blood work is showing that you may be low in B12, this would be indicated there. Now, stage 2 is when the cells have become low in B12 and they can start to change. In stage 3, we have the high homocysteine levels, which is not healthy. So homocysteine B13 is related to the health of our arteries and our cardiovascular system, and this is something that doctors will check. We want to maintain healthy homocysteine levels. We don't want high homocysteine because this can be very damaging to our artery walls, and that's something that we definitely, want to prevent by maintaining our healthy B12 levels. But also we can have a decrease in our DNA synthesis at stage 3 of B12 deficiency, so that's important as well. And stage 4 is when the red blood cells get really big. So this is called microcytic anemia, and when those blood cells are getting bigger, they're not working as well to carry your oxygen, and this is a problem. So historically though, most people were not deficient in B12. When we go back to the way that we used to live when we were in close contact with the farm animals around us, and I hate to say it, their feces, and having that great farm life, this was, not the same as how we live now. And in our over-sanitization, I think part of what's happening is that we've lost those microorganisms and that would have the potential to carry that B12 to get into the farm animals that we then eat, that we really have a relative decline in that. So we're simply not getting the B12 that we once did when we had a more simple life and less industrialized way of eating our food. So what are some of the causes of a vitamin B12 deficiency? Who's at risk? Well, certainly if you have compromised digestion, so those with celiac disease definitely usually have a vitamin B12 deficiency because of the lack of absorption in the small intestine. Also, people that are taking antacids. So in order for B12 to be properly absorbed, we need to have the pH of about 1 to 3. So it's a very low pH. Remember to make sure that we're cleaving that cobalt off of the proteins. And if you're taking antacids, you're raising up your pH in your stomach, so you won't be able to cleave out that cobalt, and then you're getting that B12 deficiency. Also, those people who are taking proton pump inhibitors as well as metformin for diabetes or regulating blood glucose, you could be at risk again for a B12 deficiency. If you've had gastric bypass surgery, then again, more risk for that B12 absorption, and that won't be happening appropriately. And that's why a lot of people who have gastric bypass, they lack in energy because of that low B12. Leaky gut syndrome. So you've heard me talk a lot about leaky gut in previous episodes. You can check out, previous episodes when I talk about detoxification and keeping our gut healthy and gut health and the microbiome. But here we see with leaky gut, what's happening is that those tight junctions have opened up, and this causes inflammation, it causes abnormal immune responses, so autoimmunity, and that dysbiosis. So now because of those faulty tight junctions, all of that undigested food gets into the digestive tract, causes that inflammation and autoimmunity, and this can also be a part and parcel as to why you have a B12 deficiency. Now, vegetarians, I'm talking to you because it's very difficult for vegetarians, if you're not supplementing, to get enough active B12 in your body. So yes, vegetarian diets are healthy for the most part, but because most of our B12, and I'm going to share the best sources of B12 from food, most of the vegetarian sources of food, you simply cannot get that B12. So it's really important, as vegetarians, that you're covering all your bases in terms of your energy, and especially if you're going to have children, as well, to ensure that they are happy and healthy and developing, especially for their nervous system. And this is really important with B12, as well as the aging population. So when we talk about, when we age, 50% of those over the age of 60 are deficient in B12. So this is important. And what, again, for the nervous system, for the health of our myelin, so what B12 does is it's very protective for our nerve cells. So our nerve cells have something called myelin on the outside of the nerve bundles, and what the myelin does is it protects and it allows for, it's like insulation on the wire here, but it allows for those nerve fibers to fire appropriately and allows for that conduction of the electrochemical conduction of what's happening here. We need that healthy myelin, and B12 is a big part of maintaining that myelin. So that's important because as we age, we know that myelin starts to break down, and that B12 is super important. Also, if you get sick, so you have an infection or you're in a state of inflammation, that will also break down your myelin. And so it's important that we maintain that B12 so that we can keep that healthy. Also, alcohol. So if you indulge a little bit too much in the alcoholic drinks, then that will also break down your myelin and put you at risk for a B12 level not being where it should be. But also when we talk about high potassium, so people that are taking a lot of potassium for whatever reason, either in their diet or maybe in supplements, they've been recommended to take potassium, that this can really deplete your B12 as well. So let's get into the symptoms. So what are the symptoms of B12 deficiency that should never be ignored? So certainly when we talk about the heart and the cardiovascular health, if you are getting heart palpitations and shortness of breath, that could be related to a B12 deficiency, because B12 removes that homocysteine, which is very damaging to the arteries, which I discussed a little bit ago. So again, we want to keep our arteries nice and healthy, and we don't want that homocysteine to build up, and B12 actively helps to make sure that our homocysteine levels are where they should be. Another symptom is dizziness. So, if you find yourself dizzy more often than not, then that could be related to a B12 deficiency. Also, if you find that you're sighing a lot and you have to take a lot of deep breaths, then that could also be B12 deficiency. If you are tired a lot, so this is usually the reason why people will go to a B12 supplement, is that they can't keep their energy up, they have fatigue, they feel weak, and especially the lightheadedness and the dizziness, they go hand in hand. This is also related to that lack of oxygenation. And remember, the red blood cells change in their structure and function when you're B12 deficient, so that's really important that we take care of that. Also, problems with the nerves. So if you experience tingling and numbness especially in the extremities, muscle weakness as well, pins and needles. In diabetics, the peripheral neuropathy is definitely a factor when we talk about B12 levels and status. And it's kind of like when your nerves are lacking in that myelin. It's kind of like the dial-up. Remember the dial-up internet, how slow it was? Well, that's the way that I like to think about it. When we are not taking care of our myelin is like the fast, your high-speed internet. We've got to keep that myelin up, because if not, then we're bringing it down to like a dial-up internet. So we've got to keep this healthy. We have to maintain those active B12 levels. And also walking difficulty. So you can imagine if your nerves are not firing as they should, then you could get off balance and have difficulty walking, and that could be, again, related to a B12 deficiency. So some other symptoms of B12 deficiency that should never be ignored would be vision loss. So if we think about the optic nerve, again, the nervous system relying on that myelin, again, the B12 is really important for having proper eyesight, as well as mental emotional symptoms. So I'm going to come back to this in just a moment, but it's important, so important, especially when we have all of these EMFs and EMRs in our environment, the blue light radiation. I think there's a definite link with what's going on, with people in terms of their mental emotional capacities and not feeling well in that department, as related to the B12 deficiency as well. Also, a red, inflamed, sore, and smooth tongue. This can be related to, again, a B12 deficiency. And one of my daughter's friends actually had this, and she came over and, we were having dinner, and she said, "Janine, I don't know what's going on. Look at my tongue." So she said, and I'm like, "Show it to me." So she stuck out her tongue, and it was red and looked a little bit glossy and inflamed. I said, B12 deficiency. And she said, yeah, I get canker sores, and yeah, B12 deficiency. Your body is telling you. So canker sores would be, again, a common sign that you are low in B12. And it's amazing when you start actually absorbing your B12, either by taking a supplement or improving the diet, or changing your diet radically. But often you have to supplement to completely eradicate these symptoms of B12 deficiency, that it's amazing that these things disappear and they don't come back. As well as poor memory. So think, as we're aging, that it's really important that we maintain that B12, because remember, as we're aging, our B12 status declines drastically over the age of 60. So that's really important. And also skin conditions. So in the literature, people who have hyperpigmentation, so the brown spots, but also the depigmentation, so vitiligo, is related to B12 deficiency as well. So a lot of people have been helped by getting their B12 on track where it needs to be. So what are the benefits of vitamin B12? Well, it's important to know that it helps with the metabolism of our carbs, our fats, and our proteins. So yes, we need to have enough B12, and to take it, and making sure that we're having enough B12 every day, because we need it for our metabolism. And this could be, again, one of those hidden factors why people can't lose weight, or they struggle and they lack in energy, then they don't have the energy to exercise, is when they do not have enough B12, and now they're not turning their food actively into that energy. So that's really important. It also protects the nerve cells, and because of that myelin, which I discussed before. So again, when we talk about myelin, I have a study which shows that the B12 deficiency is related to the different types of, supplementation of that B12. It was the adenosylcobalamin, which helps with carbohydrate, fat, and amino acid metabolism, so protein metabolism, but also has a lot to do with the health of the myelin of our nerves. So really, really important in terms of keeping our nervous system and our brains active and alive and healthy. And that's why memory, then, you can imagine, is related and is one of the benefits of vitamin B12. Now, vitamin B12 is also needed for phase 2 detoxification in our liver. So for anybody who's studied, biochemistry, and you've learned a little bit about physiology in the body, maybe you've heard about there's phase 1, phase 2 detox that happens in our liver. So this is important for phase 2 detoxification in our liver. So this is a liver, and it's on the right side of our bodies, just underneath our rib cage, and that's important. So, when I get to the tips on how to help our vitamin B12 status and absorption, this becomes important, what I'm talking about here with the liver and the health of our liver. As well as, the benefit of vitamin B12 is it helps to remove that homocysteine from the blood. So remember, when we want to have, I'm going to grab my artery here, when we want to have healthy arteries and making sure that we are maintaining the health of the arteries and that blood flow, because we don't want the blood clots happening, which is, can potentially happen, and that's not what we want. We want to maintain those healthy homocysteine levels, and B12 helps to eliminate the homocysteine. So what are the best sources of vitamin B12? Well, at the top of the list is organ meats. So for all the carnivores out there, maybe you want to start to incorporate some of the organ meats into your diet, if you can go that far as to do that. So beef liver, for example, has 83 micrograms in 100 grams of cooked beef liver. So again, if you're going to go in this direction, make sure that it's, if you can, get organic grass-fed organ meats to make sure that those toxicity levels are down if you're going to be consuming this. And I know myself as a kid, I used to love liverwurst and yeah, there was a reason for that. And I actually loved liver and onions. I haven't had it in years and years and years. My mom used to cook it for me. But yeah, and considering the B12, I might venture back to the liverwurst again. I'll let you know how that goes. But if you love liverwurst, I'd love to hear from you, being, my Germanic background. I would love to hear from you if this is something that you consume, and then if you find that it helps with your energy levels. Now, next on the list is oysters. So oysters have about 16 15 micrograms in 100-gram serving. So oysters, yes, I love oysters now. This is something that I told you in a previous video that I was going to embrace the whole raw oysters, and I did, and I love it. I even got the kids to eat it, and even my husband, who was dancing around the kitchen in his first attempt at the raw oysters. But it was funny. I got it all on tape on my phone, so it was great. As well as clams. So again, the seafood is high in these nutrients. So the clams have about 11.3 micrograms in a 100-gram serving. Canned tuna has 2.6. So you can see a relative decrease. So again, 2.6 micrograms in a 100-gram serving in your canned tuna. That's not a whole lot. Remember, the beef liver was up at 83 micrograms for the same amount, per serving. So again, everything considered, that the organ meats, not something you would have to do all the time, because B12 actually recycles in your liver. So that's a great thing, and I'll talk about that in just a second. But also the shiitake mushrooms. So for the vegetarians that you're trying to, get, you would need about 50 grams of dried shiitake. So again, this would be very concentrated to get your daily requirement of your vitamin B12. And nori, so seaweed. If you're a sushi eater, you love the snacks of the seaweed, 4 grams would be required for your daily requirement. So again, it's very light, so you would need to eat quite a bit of it to get, a little bit of B12. So here's the thing about vitamin B12 is that a B12 deficiency can actually mimic other conditions. So things like Parkinson's disease. So if you missed the first part of today's episode, I talked about some of the symptoms related to B12 deficiency and loss of balance and not being, and muscle coordination, numbness and tingling, and tremors even are related to a B12 deficiency, as well as MS. So when we talk about multiple sclerosis, one study has shown, which is interesting here, that we can see that the cause of multiple sclerosis is autoimmune attack of the adenosyltransferase, thereby limiting adenosylcobalamin production, meaning that what the researchers were identifying in this piece of research was that the autoimmunity was actually, started off and was part of the whole disorder of the MS manifesting itself because of bacteria that was depleting vitamin B12. And we know that in terms of keeping the myelin sheaths healthy and happy in our nervous system, and for the nerves to be firing appropriately, that was, to me, when I was like, oh my goodness, that, remarkable to know that. So yes, these things we have to do our best to prevent and for our overall health, to keep our vitamin status where it should be. And that's why we do these shows, and I share this information so that whether it's from a preventative standpoint, but also to help you if you have one of the things that we're talking about today, that, by maybe improving your environment and your B12 status, that you'll be able to help yourself. As well as dementia. So when we talk about the lack of B12 and the brain function, this is definitely a correlation, as well as fibromyalgia. So a lot of aches and pains and chronic fatigue syndrome could be mimicked by that B12 deficiency. Also in terms of learning ability, so again, B12 has a lot to do with the brain power. So ADD, ADHD, autism could also be manifested and because of that B12 deficiency. And neuropathies, so whether this is in the diabetic or in somebody who's experiencing a lot of nerve issues and the tingling and the numbness, again, make sure that you're checking out your B12 status. So I promised I would talk about vitamin B12 and the mind. So definitely related when we have a B12 deficiency to depression. So not feeling well, not having the blues, and just not feeling great could be that lack of vitamin B12. And this, I think, is common sometimes that vegetarians don't like to talk about, and vegans. I've seen some very unhealthy vegetarians and vegans, and it's important that you are maintaining, if you are vegetarian or especially vegan, that you're maintaining. 80% of vegans have been reported to have a B12 deficiency. That's a huge number. That's most vegans are low in B12 if you're not actively doing something about it. So please, word to the wise, do do your best to check your B12 status, but also stay on top of it in terms of getting enough if you need to supplement. Also memory loss, which I discussed before. Some of the other, relations between B12 and the mind would be mood disorders and behavioral problems. This could be in the youngsters as well, but in adults too. Paranoia and also delusion. So just, not being balanced mentally can be related to that B12 deficiency. So now I'm going to share 9 tips for how to increase vitamin B12 in your body. So tip number 1 is to include organ meats in your diet. If you can do it, you can also, if you're not going to venture into the organ meats, the liver, the beef liver, you can also go to seafood. So clams and oysters are also great sources of B12. Tip number 2 is to make sure you're getting enough sunlight. So yes, sunlight is important, but with tip number 3, it has to be in conjunction with having enough water and good quality water, because the two work hand in hand in maintaining your B12 status and for it to be able to recycle in your liver so that you don't run into a deficient state. Tip number 4 is to do seasonal detox to keep your liver healthy. Now this is important because we know that our B12 recycles through the liver, so we want to keep our liver healthy. Tip number 5 is to decrease our alcohol, so that goes hand in hand with keeping your liver healthy, which is so important. Tip number 6 is to avoid antacids whenever possible, because remember that cleaving of that B12, especially if it's dietary or methylcobalamin from a supplement, the cobalt needs to be broken off from the proteins, and we need to have that low stomach acid, that low pH, to be able to make sure that that is coming off so that we can utilize the vitamin B12. Tip number 7 is to make sure that you are fixing your leaky gut syndrome. So if you do have a leaky gut syndrome, make sure that you're repairing that gut. We have other videos that can help you to do that, to repair up those tight junctions and to do it in a way that, you're healing, getting your energy back and feeling better as you're doing that. Tip number 8 is to supplement. So if you're going to go towards, supplementation, which a lot of people have to do, I myself have to take B12, and I take the Adenosylcobalamin. Again, you want to be wary, so read your vitamin bottles. Or if you're going to the health food store to purchase a vitamin B12 or a B complex, make sure it does not say cyanocobalamin, because that is cyanide plus cobalamin. It's a really inexpensive way to formulate B12 supplement, and you have to ask yourself, how safe is it if it's bound to cyanide? And tip number 9 is to practice my Dr. Janine self-healing meditation for vitamin B12 deficiency, which we're going to do right now. We're going to get into a meditative state, and by focusing in on our absorption and our utilization of our B12, we will help to have that positive impact on its absorption and on our energy levels, on our nerves as well. And we're going to start that now. So you will be listening to this. So this is something that you can refer back to. We'll also have a longer version of this here on YouTube that you can refer back to. You can play this as binaural beats, so you can listen to this with headphones is ideal to help for your brain to make up that third sound. And that's how binaural beats work. Your brain makes up that third sound so that you get the added benefit of actually healing your tissues. All of these are tailor-made for whatever we're trying to meditate and focus on in our body to get the exact right hertz to have that healing impact on your body. So you only get that binaural effect if you have the headphones on. Okay, but for today, because you don't have your headphones, I'm sure when you're watching this the first time, what we're going to do is we're going to get centered down, and we're going to take a few deep breaths and keep your feet flat on the floor if you can. If you're sitting in a chair on the couch, you can also sit on the ground cross-legged, or you can even lie down as we go through this. And we're going to go through our meditation by just closing our eyes gently and taking a few deep breaths, tuning in, listening to the relaxing music, and allow your breath to fully come into your lungs. Holding your breath at the top of your breath after your inhale for just a few seconds, and allowing your air to escape. And inhaling again. And exhaling. And now we're going to focus in on our digestion, that we have perfect digestion and absorption of our vitamin B12 in our stomach, and going to the small intestine and cycling into the liver and through the liver and recycling as it should. Now we'll focus in on our nerves, that all of our nerves and neural tissues have healthy myelin. Again, it's like the insulation on our nerve cells. So that healthy insulation is coating our nerves, allowing for proper nerve signals to communicate with one another, keeping our brain healthy, our nerves through our spinal cord, and all the nerves in our body. Everything is functioning perfectly, exactly how it should. And if we have a deficiency in myelin anywhere in the body, that myelin is now being built up and repaired. Eliminating any imbalance in the myelin, in the way that our nerves are firing. So that we now have perfect balance and harmony and connection to our vitamin B12 status. And we allow for it to continue to recycle and be utilized through our body as needed on a day-to-day basis. And a few more deep breaths in and out. When you're ready, you can gently open your eyes. And welcome back. So, I can't wait to hear how that went for you, and continue to use this if you know that you have a B12 deficiency. So maybe you're taking, your supplement and maybe you're not getting all the benefits that you should be. Maybe your energy isn't where it should be. Maybe you have MS. If this is, or somebody who has MS, please share this video with them, because it's something I'm sure they haven't seen or heard of before in terms of being able to visualize. And it's important to know that, if you're new to this and to energy medicine and things, when you ask for and you focus in and tune into your own body and that connection that we have with the earth and powers greater than ourselves, how incredible it is that healing can happen instantaneously in that moment. And the more that you practice this, the more that you're building up your myelin just through that meditation and healing your brain and healing your nerves. It's incredible. I mean, I've experienced, and a lot of people have shared with me their life-altering, in a good way, stories as to how this can really help. And team it up, certainly. If you've got to get your B12 levels up, team it up with a great supplement. So we have links below to help you in that department. But, do your best. This is part of your health journey. I'm glad to be on the journey with you. And, always leave your questions and comments below. I love dialoguing with all of you. It's me who's responding and answering your questions and engaging with you. So I love that interaction, and please continue to do that because I really do truly appreciate it. So I hope this video helped you. Please give me a big thumbs up. Make sure that you're subscribed and you click the bell as well. And remember to always take care of your good health and to do it naturally. Thanks for watching.